Hi, I'm Dr. Eric Kaplan. Welcome you here into one of our Knee Centers of America offices today, where we're located now in 45 states and over 245 clinics. Why? Because we offer a pain-free solution, not only for back pain, not only for hip pain, but we also now have a solution for knee pain. There are so many people that have unnecessary knee surgery. When talking with Norman Shealy, MD, PhD, the most published in the world, he realized that knee replacement surgery is not always the answer, and that with any type of surgery or injection come serious complications. Well, at Knee Centers of America, what we do is we offer an alternative, drug-free solution. We utilize research from Harvard, from the Mayo Clinic, from Johns Hopkins, from Stanford, leading universities and teaching hospitals, trying to give you a drug-free solution for knee pain. So I want you to sit back, enjoy the moment, and if you came in on a walker, let me tell you something, we look forward to you walking out pain-free naturally. I'm Dr. Eric Kaplan saying, let's take a journey throughout our clinics and see how we can help you.
So we have the distinct honor and privilege here to be with former NFL lineman, former All-Pro, former team captain, Dwayne Clemens here, who just simply completed his matrix treatment. And there's a little bit more to the story. Can you share with us a little bit, Dwayne, about how this presented?
Absolutely. One of the things that happened over the course of my 10-year career was the first knee injury I had was a meniscus tear. And then I had a knee reconstruction, and then I had several more meniscus tears. So in the process of getting those tears repaired, I had tremendous scar tissue, lots of pain, lots of inflammation, all the things associated with it. I know how much damage painkillers and drugs do to you, and obviously I've been through surgery, so that's not what I was looking for. I wanted something non-invasive, drug-free, healthcare that I could be proud of, especially as a board member of Give America Hope, which is a foundation trying to get people off of prescription drugs and heroin. Being able to work with something like the NeuroMed, I was able to come in here in a lot of pain, be able to attach the equipment to my leg, and within 30 minutes, I felt probably 90% better. I'm more mobile, I have more range of motion, I have less pain, and this is just the first treatment. So I'm just looking forward to going through the whole program and being pain-free for the rest of my life.
I want to thank Knee Centers of America for giving me the opportunity to get my quality of life back, to be able, to provide for my family, to be able to, to go on with a normal life. Whereas I gotten to the point where I didn't know which way to turn. Now, every door was closed through medicine. Medicine had closed every door on me. So the way out of it was not going through a physician, through medicine. And I would have never thought that would have, that would have been the answer, but it is the answer.
Most people are told they need knee surgery when pain interferes with daily life. But leading medical experts agree, chronic knee pain does not automatically mean your joint is beyond repair. Decades of orthopedic and sports medicine research show that motion is essential for joint health. As explained by Andrew D. Pearl, regular knee movement circulates synovial fluid that nourishes cartilage and protects the joint. Simply put, motion is lotion. The less a knee moves, the less lubrication it receives, and the more pain increases. Most chronic knee pain is not caused by bone grinding on bone. Pain often develops when the protective cartilage thins over time. Small defects can form in the cartilage surface, leaving nerve endings in the bone less protected. That's why normal activities like walking, standing, or climbing stairs can become painful, even without severe joint damage. This understanding has reshaped how non-surgical knee care is approached. Working alongside Norman Shealy, a former Harvard professor and one of the most published physicians in neuromodulation and decompression science, doctors help develop advanced non-surgical knee technologies designed to restore motion, reduce joint pressure, and support the body's natural healing process. Dr. Shealy has long emphasized that surgery should not be the first option when effective, non-invasive alternatives exist. Knee replacement surgery carries documented risks, including blood clots, nerve damage, infection, implant failure, and the possibility of revision surgeries later in life. Facts supported by major medical institutions such as the Mayo Clinic. That's why this approach focuses on restoring function, not masking pain. Using research-backed technologies such as decompression, laser therapy, shock wave treatment, and targeted neuromuscular reconditioning, The goal is to normalize joint mechanics, reduce inflammation, and reactivate weakened muscle groups that support the knee. As pain decreases, patients naturally return to proper heel-to-toe walking. Improved movement restores muscle balance, reduces joint stress, and creates an environment where healing can occur without surgery, injections, or long-term drug use. In just a moment, your doctor will review your individual findings and explain whether this research-driven, non-surgical approach is appropriate for you. What's important to understand now is this: many patients still have options, even when surgery has been recommended.
I enjoyed my treatments. They really helped me. And each time, treatment I had, I walked out of here better. It took a while, but it was worth it.
It's relaxing, it's painless, and it works.
This is the place to go, because when all else fails, they're going to tell you exactly what it is that they can do for you. And if they can't help you, they will let you know. And that's what I like about it. They're straightforward and they're honest, good people.
Everyone here just goes out of the way to make sure that you're not suffering any more than you need to be.
Hi, I'm Dwayne Clemens, 10-year veteran of the Kansas City Chiefs, Minnesota Vikings, and Cincinnati Bengals. When I was playing in the NFL, early in my career, I suffered a torn meniscus in my right knee. After that, I had a total knee reconstruction because my patellar tendon ruptured 2 years later. After 6 knee surgeries, I had enough of surgeons, drugs, anti-inflammatories, and I wanted a non-invasive, drug-free way to heal my body and to stop my knee pain. At Knee Centers of America, I was able to find the modalities, the practitioners that gave me the healing chance that I needed, and they were able to repair my body and keep me back on the field. These are the things that they have here. They're the best at what they do. You won't have drugs put in your body. You won't have needles put in your body. You won't have practitioners who want to cut you open. You have practitioners who want to basically find the best non-invasive drug-free ways to heal your body, and you will get results.
Since the day we came in here, I felt like I was in a place where they really care for people.
Patients report less pain, more mobility, and better function without drugs, needles, or downtime. If you're tired of chasing pain, this may be the solution you've been looking for.
I want to take this opportunity to thank you for watching this video here today and for learning that yes, there are some solutions. By utilizing technologies that brings the difference for our clinics versus other clinics, by utilizing things like the Matrix, by using the AccuKnee, by utilizing laser, both Class 3 and Class 4, we are now able to remove knee problems without opioids or all these anti-inflammatories that cause stomach problems and bowel problems and all these other situations. There's a reason why professional athletes like Dwayne Clemens have come to us, who's had surgeries, and he says, I don't want it anymore. Please, doctor, help me. Well, we're here to help you. So I want to take this opportunity to say thank you for coming here. I'm sure you're going to enjoy the doctor that you're working with. These are the most highly trained doctors in the world, studying research from Harvard, Yale, Johns Hopkins, you name it, we study it. Why? It's not our goal to be good. It's our goal to be the best. Thank you for your visit.